Madam Speaker, Fairfield is one of New South Wales' most multicultural and multi-faith communities, but is also the state's most socio-economically disadvantaged local government area. That's why discussion about Fairfield's emerging mental health needs and challenges is desperately needed. In that regard, I recently hosted a mental health forum in Fairfield, bringing together the Minister for Mental Health, Rose Jackson, Federal Minister Chris Bowen, leaders from New South Wales Health, schools, community groups and places of worship to discuss the emerging mental health needs and challenges facing the Fairfield community. There were 13 recommendations submitted as part of my report derived from this forum to the New South Wales Government. I will now highlight 6 of them. 1. The delivery of mental health and counselling skills training for faith leaders, given their direct and frequent contact with youth and cold community members who need mental health support. 2. The development and execution of a strategy to reduce the stigma of mental health support, specifically amongst cold communities. This may include targeted advertising campaigns, engagement activities, and financial and non-financial measures to incentivise the recruitment and retention of multilingual mental health support clinicians who may serve to normalise the seeking of mental health support rather than it being regarded as taboo. 3. Mental health navigational support for young people in their transition period post-high school. The increase in mental health issues observed among young people transitioning from high school to adult life is significant. Attendees raised the inability of schools to address mental health in isolation, given the number of cases, the limited number of counsellors available at schools, and the months-long wait for students to access external psychologists. Discussion highlighted that the transition period from high school to adulthood was a period when mental health issues may become acute. This is especially the case where there is a school support network whilst young people are studying, but it dissipates when graduating. Long-term support was therefore stressed as a weakness, as there was no localised, dedicated mental health support available for youth once they graduated from high school. 4. Removing the financial barriers to access mental health support. For example, there is an inability of members from low socio-economic backgrounds prevalent in Fairfield to access bulk billing psychologists and related clinicians. Attendees suggested that Medicare cover a higher proportion of the cost of mental health support to reduce the financial barriers to access. 5. Strategic funding for culturally appropriate community hubs to serve as a referral base and localised directory for mental health support, alongside other support services. The recommendation was raised for government subsidies to assist with trauma-informed, light-touch support services such as community hubs that connect vulnerable members of the community with mental health support, employment opportunities, and other members of their cultural group who have sought similar services. And 6. The development and employment of a synchronisation strategy to build mental health referral triage capacity across key government and non-government sectors. Individuals present to different government and non-government organisations for an array of reasons not related to mental health support, despite presenting symptoms suggesting the need of such support. The current system lacks efficient referral and case management synchronisation, making it difficult to seamlessly direct individuals to seek mental health support, including the most appropriate services. This gap should be covered. To the stakeholders who participated in the Fairfield Mental Health Forum, I sincerely thank you for your participation. This is exactly what good government is about. Listening and working with the community to improve our society. Thank you.